Great, thank you, doctors. We've got some questions. Let me just throw some out. What are the most common treatments for severe constipation, and for a case of megacolon, what is generally used?
Lots of, whatever works, whatever you can get the kid to take and whatever will work. Medication wise, I will use Miralax if the kids will take it. I don't want to come across as anti-Miralax, but most of the kids, like I said, there's a good portion of the kids that Miralax won't take it. But the other thing is, I think one thing we do differently at motility centers that are done than what's done at most like general GI practices, we use a lot of stimulants. So that stimulants would fall into two medications, Synacot and Docalax or Bisacodyl. Synacot comes in like the X-Lax, the chocolate squares. Also comes in a liquid form that you can mix in with other things. It comes in tablets also. Docalax, small little tablets. Sometimes I can get the kids to maybe swallow that with some applesauce, ice cream, pudding, whatever. But we use a lot of stimulants and we use them daily. Whereas a lot of times at other places, even when I was early in my training, we were told, no, only use it 2-3 times a week at most. But we use a lot of stimulants to give that extra push through those areas of megarectum. Plus, the other thing I think it does is it actually increases the transit, increases the pressure up against the anal sphincter. And I think it actually helps overcome the resistance of these kids to pass stool. So we do use softeners, but we rely heavily on stimulants at that point.
Is there harm to frequent daily use of suppositories? And is there a difference in the type of suppository?
Great question. The problem with a lot of our kids is trying to even do it safely, right? I've had parents try to use enemas to do a removal of fecal impaction, and they're trying to basically ram a enema in there, and they miss, and they cause a huge scratch and scar on the kid. So that's more of the danger than, say, reliance upon a daily enema in itself. Because that cectostomy I talked about, basically, that is doing enemas every day, but you're doing it from the top down. There's not a lot of harm to doing enemas necessarily every day, other than my concerns would just be how comfortably are the kids doing it, how easily is it done, and those things. Now, that said, I definitely have kids. They know that if I do an enema, I feel good, and they'll help and assist and do their enema, so it's worth a while. The different enemas we use, the one I like the best is one that is the enema form of the Docalax I talked about. It's Bisacodyl. It's about 30 ml, so it's about 1 ounce. It's got Bisacodyl in it. So it doesn't create a lot of absorption of things, and it really helps the bowels contract and get the stools out. That's the one I'd like to use the most if I can. I do get a little concerned about using, let's say, daily fleets, the phosphol soda ones, because that can cause, if you're absorbing that fluid into your gut and absorbing it into the bloodstream, that can cause different electrolyte abnormalities. So I tend to try to only use those a couple of times a week at most. And I tend to warn parents, like, try to make sure that's being evacuated fairly soon. It's just not staying in the intestine and being absorbed. But those are the two enemas that I do a lot of. And then there are just suppositories, glycerin suppositories, Pedialax. That's a good one too. That one can be used every day also, because we use glycerin every day in our antigrade system. So it's okay to use it from below also. And then there is Docalax suppositories that if the kids are able to withhold it. But the problem with the suppositories, like just a capsule suppository, is getting a kid to actually hold it in long enough for it to be absorbed.
Great. What are some of the common found causes of chronic diarrhea?
Constipation would be the top of the list if a kid came to me with developmental disorders. Next would be functional diarrhea, which would actually like toddlers diarrhea is what is another name of it. If the kids between ages 3 and 5, all these kids though that come to me, let's say they don't have constipation, I usually will screen them for infections. I've had a few times where like Giardia, chronic infection with Giardia has been found, and those things. Probably in our clinic, the most common one would be toddlers diarrhea, functional diarrhea. It's also called chronic nonspecific diarrhea.
Okay. Is there any link between modified diets and severe constipation in neurodevelopmental disorders? Has anybody studied this?
So diet is a very interesting thing. What we found when we try to study, it's very hard to do because everybody's diet is so different. The symptoms are so varied. People have tried to look at this. There has been people always reporting like a gluten-free, casein-free helps with constipation and things like that. An interesting study that was done with that, where they did it blinded, they didn't see any difference. However, what they did notice was that when parents try to follow a gluten-free, casein-free diet, they tend to have a healthier diet. So they're eating more fruits and vegetables, or they're getting rid of a lot of processed foods and those things. So the interesting thing about diet is it's not the primary cause of the constipation, but if you're able to improve the general health of the diet, say with more fibers, more fluids, you're going to make constipation less likely and maybe more severe. But there hasn't been any studies really with any diet saying like it causes the constipation. And so far, it's really hard to do a study that's open label saying that this helps constipation. Any of the studies that have been blinded have not found an association between diet and constipation.
Let's see, how related is GI to urine retention and any solutions there? And this is something I've seen anecdotally in the PMS community.
Probably my second best referrals clinic is urology. Constipation is the #1 cause for urinary retention, urinary accidents, bedwetting, in kids who've been toilet trained. It's one of the, I don't know if it's the most common, but it's one of the most common. What happens is that, if you go back to that picture I showed, I mean, I've actually had kids come to me. I had one young girl come to me once. Her belly was completely distended. She was coming to me for constipation. And yeah, she only pooped about once every 2 weeks. So I was thinking like, this kid's completely impacted. Her distended belly looking like a big, medicine ball in it. It's all from stool. Turned out it was her bladder, that she did have a big stool ball. But the problem is that the anatomy is that the rectum presses up against the bladder, can actually obstruct the outlet of the bladder, so they can actually cause it not to want to empty, and then it causes overflow. So that once it's kind of like, the other thing is, if it doesn't cause a complete obstruction, is it gets so full that eventually it overflows and you have urinary accidents. So the first treatment for urinary accidents and things is to treat the constipation.
There's a few questions about Miralax, and I know there was some controversy about a study that came out, and then, it wasn't a great study. Can you just give us a recap on that?
I don't know about any studies coming out. There's been a lot of people claiming that Miralax causes neurological issues, behavioral issues, and things like that. We're actually here nationwide. I'm the only person I know that's actually looked for the toxins that are associated with Miralax, and there are small traces of toxins. So Miralax is a big polymer. It's polyethylene glycol, and it's based upon ethylene glycol. Now, ethylene glycol, single molecule of ethylene glycol, is toxic. But polyethylene glycol is not only used in Miralax, but it's used as a food additive. It's used in other additives with other medications. It's used in makeup. It's used in eye drops. It's everywhere. So when we went looking for ethylene glycol and diethylene glycol in kids on Miralax, what we actually found was there was no increased level between kids on Miralax and kids not on Miralax. In fact, it probably was sampling error, but what we found was we actually had a higher level of diethylene glycol in the kids not on Miralax. Then the other things we've done too here is we've done animal studies looking for neurological changes associated with high doses of Miralax and polyethylene glycol, and we didn't find it. So in my experience, 20 years of doing this, the side effects of not treating constipation is way significant more than any potential side effect from Miralax. And Miralax is one of our best stool softeners, so I wouldn't hesitate to use it, even in the very young. But with that being said, the one thing I teach my fellows and I teach our residents, Miralax is not the only one out there. If a family has an issue with Miralax, use a different laxative.
Great. Dr. Jimenez Gomez, a lot of these neurodevelopmental disorders have a comorbidity of seizures and not sleeping, which involve a lot of medications, maybe medication cocktails. Are there related side effects affecting the GI tract there?
Certainly, there's a very broad variety of medications that we use for seizures, and oftentimes they have very different mechanisms of action, and it really is tailored to the individual type of seizures that children may have, or the symptoms that children may have. So we use things, for example, clonidine or glomphosine, some medications that tend to, let's say, make the child, soothe the child or soothe the individual a little bit. Sometimes we use antipsychotic medications and whatnot, but it really is very individualized to the medication and the context in which it is used. I mean, certainly there are some anti-seizure medications that have constipation as a side effect. There may be some that some parents report that it is all the contrary, that they have had diarrhea or they have had more frequent bowel movements, even to the point of incontinence sometimes, and it may even seem sometimes paradoxical. Now, we are using, let's say, more medications from our perspective, and in part also from the parent-guided, let's say, management with supplements and whatnot, in which you see an inherent impact in gut function. So, for example, a lot of children, whether for behavior in a less prescribed manner or for intractable epilepsy in more of a prescribed manner, we're using derivatives of cannabidiol, which is cannabis essentially. So those have an impact in gut motility as such, just as much as we're seeing, for example, a frequency and use of things like magnesium and magnesium supplements, which we know also have an impact in gut motility overall, and they serve as a laxative in some contexts of. Some parents find a relief in, some of the behavioral symptoms, but they might find that it is linked to a relief in some of the GI symptoms, or they may find that it's independent and you've kind of switched one, let's say, situation for another. But it's certainly a very broad question, so to speak. So it's, I see a fair bit of it, but it's how frequently and with which medication, it really depends on what we're talking about individually.
Dr. Williams, as a follow-up, one of the topics and one of the working groups is education, and specifically of GI fellows and residents. Is there a disconnect between what the neurologists are having to prescribe and what the GI specialists are seeing, or is there an awareness?
You mean a disconnect that, like, the GI
of information? Sorry,
like they don't know,
right?
They don't know like what the side effects are potentially of the medications.
Correct.
I think that's true for most people. I'll be honest with you. I mean, because Andre, I'd very much like to hear on this. A lot of times the potential side effects are both. I mean, you look up the potential side effects, it could be constipation, it could be diarrhea. You have to worry about it in the individual person. And it's really tough to find out, I think, except sometimes there's a clear history. You start this medication, we were able to come off all our laxatives, and we're having diarrhea, those kind of things, or they all of a sudden need it. So I think most of us look for the potential side effects. A true understanding of which ones do what, it may be a little bit difficult, but I do think we try to keep in mind that any medication that alters neural activity basically is going to potentially alter gut activity. So the way we look at it.
We actually had parents that said they didn't want to answer the surveys for this study that Dr. Bennett showed us the results for, because they weren't sure what the cause of the GI issues were, whether it was the syndrome or whether it was the medications. I see Heidi, which is my wrap it up card, so I will let her continue.
So we're going to now move into the final talks of the day. Thank you both to Dr. Williams and Dr. Jimenez Gomez. If we did not answer questions from the chat, we apologize, but we will definitely take them into consideration and try to get some information back onto the website. We're now going to move to the next event on the hub, which is the spectrum of GI issues in neurodevelopmental disorders and their impacts. So please go ahead and click the session in your schedule in the platform to join us, and we'll see you there soon. And you guys can just, if you exit,